watching Dr. Doctor, the show dedicated to your health and well-being. Free advice for an hour each day throughout the summer. I'm Dr. Mark Porter.
And I'm Dr. Raj Persaud. Coming up, beating the blues. Call us on 08712 44 25 44 if you or someone you know is struggling with depression. We'll be examining how to recognise and deal with the symptoms of depression.
But first, Foot Solutions. Not the nicest of jobs, you might think, but someone's got to do it. Well, our next guest looks after people's feet at London's Guy's and St Thomas's Hospital. Consultant orthopaedic surgeon, Sam Singh. Sam, let's start by, what's the difference between an orthopaedic surgeon with a special interest in feet, a chiropodist and a podiatrist?
Yeah, so an orthopaedic surgeon, so I've gone through medical school and then 10 years of surgical training, and I've elected to choose the foot and the ankle as the area of special interest. A podiatrist undergoes a much shorter training, but is actually allowed to operate on the foot as well in certain...
So podiatrists are actually doing surgical operations?
Yeah, some places, which is kind of surprising because, you know, there's no other part of the body that can be operated on by a non-medically qualified surgeon. A chiropodist is someone who tends to look after more, you know, the toenails, more the
surface
general
stuff.
callus and more the surface stuff around the foot.
So in your clinic, what sort of patients do you see? Presumably they're referred to you by GPs.
Yeah, I see the full spectrum. We start with, say, ankle arthritis, ankle injuries, nerve problems around the foot. A lot of patients have problems with the front of their feet, and, for example, bunions, hammer toes, arthritis in the big toe, and these are the kind of common conditions that come to the clinic.
Well, I'll start with bunions, something that I'm sure everybody's heard of, though not everybody might understand them. So let's have I know we've got a picture of a bunion that you brought with you. Let's have a look at a bunion. I want you to actually explain what a bunion is and why you get them.
Okay, well...
So looking at the picture here...
yes.
Bunions on the left, that's the first clue I'll give the viewers. Right? Talk us through the abnormality.
Yeah, so the bunion is that big lump on the inner aspect of the foot you can see.
So on the right of the foot as we're looking at it,
the foot. And it's made up by a combination of things. It's a combination of soft tissue swelling, a bit of bony prominence, but also the bone itself has started deviating. And if you look at the X-ray, you can see that the two bones are kind of splaying apart. They should be more parallel like the other bones in the foot. But these are splaying apart.
Can you just demonstrate that on the foot that we've got in front of there? So here's somebody's foot without flesh.
So this is someone's foot. This is, we call, just so we know what the metatarsal is, because it's been in the news, this is a first metatarsal, second, third metatarsal. And what happens in a bunion is that the first and second metatarsal end up splaying apart, become more V-shaped. And as a result, the patients notice more discomfort around this region.
So basically that joint's being pulled out.
Yeah. So often patients come and see me in the clinic and say, "Doctor, can you just knock off the bump?" But that's not the solution. The solution is you actually have to often cut and realign the whole bone to correct the bunion deformity.
OK, why are people getting bunions in the first place? I noticed that Posh Spice was in the papers recently, Victoria Beckham, as she prefers to be called now, and we've got a picture of her feet as well, with her famous for wearing her Jimmy Choos, etc., the high shoes.
And you can see, it's a nice picture of...
On the right there, and that looks to me like an early bunion.
It does, it certainly does. And
so it's now official.
I'm sure that hurts.
Is that anything to do with wearing shoes?
Well, I think she may be wearing... Not something quite like this. But
no, probably a bit more fashionable than that.
But this is a typical shoe, and this is one of the reasons we see bunions more in Western countries.
Right.
Certainly, I find I have a lot of doctors training with me from abroad, from the Far East, and they don't see bunions there.
Got people walking around on flat feet or bare feet.
Bare feet. That's the key thing. Or wearing sandals like we're all wearing in the summer.
Okay.
What happens is when you wear a heel shoe, that's why bunions are common in women. What happens when your foot tends to want to slide down.
Yeah.
So it slides down a thing, and that squashes the toe. Now, the toe box of the shoe is already very narrow, and as a result, the toes get even more squashed. And eventually, they start overriding one another, and that's probably one of the contributing factors.
One of the things you see in general practice is, you know, a daughter comes in and says, my mother had bunions as well.
And certainly not all bunions are caused by bad shoe wear.
It's a factor.
It's a factor. Most bunions occur, half of them, I'd say, occur from familial causes, it runs in the family. And if you ask them closely, the aunts have got it, the granny's got it as well.
But it's an extremely important factor, isn't it? I mean, I read somewhere that 90% of all foot surgery below the ankle occurs in women. It's because women are wearing these shoes that destroy their feet.
It is very true. If you look at, for example, only 10% of bunions are in men.
Yeah.
And it's interesting when you get a bunion in a man, it's usually quite advanced, and often by the time they come to you, they're in trouble.
So there's an interesting question about why women do this, in terms of why they wear these things that destroy their feet. And a lot of people say it's about fashion and
Raj, the programme's only an hour long.
But I think it's a lot about the way these shoes make make women feel a particular way, don't they? They make them feel more powerful and more sexy.
I think they do, and I think there is a role for it, and that's why, you know, whilst the treatments for bunions are typically non-operative, wearing wide shoes so that you have more space for the toes. Also, you want to reduce your heel. What we'd say is an optimal heel is usually considered to be about 1 inch is what we allow, really. Yeah. Beyond that, you're kind of pushing it.
I can't see many of my patients going for that. Let's go to the telephone calls and see if we've got some calls. Elaine?
Yeah, line one, I've got Dee from Worcestershire.
Good morning, Dee.
Good morning.
From Worcestershire, just down the road from my home county, Herefordshire. What's the matter with your feet?
I've been diagnosed with plantar fasciitis, which is very painful.
Right, well, tell us how it's painful. What symptoms do you get?
Very hot pain in the balls of the feet, very sharp pains in the heels, and very horrible pain around the ankles.
Because the classic plantar fasciitis, it goes by a little differently. The one that I see in my waiting room, someone comes in, they've been on a holiday often, and maybe they've been playing barefoot on the beach or something, and they come back from their holiday, and every time I get up in the morning, doctor, it feels like I've got a stone in my shoe until I get going. Explain what... Let's use your model. Yeah, this will ring a lot of bells. It's a very common problem.
The plantar fascia is it's like a tight band, and it runs under the foot like this. So it starts at the heel there, and it runs and it fans out underneath the foot. Now, the problem with the plantar fascia is that it tends to get very inflamed, and as we get a little bit older and we get less used to walking on, say, hard surfaces barefoot, the same surface it becomes irritable, and it starts developing micro tears, and you get commonly you get pain at the insertion. Now, the thing you said, which I did appreciate, was very correct, is typically it's the first few steps in the morning that are the worst. Now, if you compare that with arthritis, which is usually worse at the end of the day and better after a night's sleep.
And presumably that's because it's trying to heal itself overnight and it's stiff and contracts up, and then you go and put your weight on it.
If you look at the position of our foot, what we tend to do is we always tend to sleep with our foot down, because that's how we're comfortable. We put a duvet on, that's how we sleep. Even if you sleep on your front, you always sleep with your foot pointing down. Now, what happens after that is when we get up and take our first few things, in essence, we're stretching the whole thing for the first drum. And that's why they get pain. Because
you can actually use stretching to help milder cases of plantar fascia. Perhaps you could demonstrate the stretch that people need to do.
Now, what we do to stretch the plantar fascia, we actually stretch the Achilles tendon and the gastrocnemius muscle, because it's all linked.
The calf.
Yeah, that essentially. So the calf stretches is what stretches your plantar fascia. So the key thing to do is to stand feet about 1 foot apart. Always make sure that the feet are pointing straight ahead. With this knee, you bend your front knee, and your back leg needs to be totally straight. And notice I'm not doing any bouncing like you see him doing on the football pitch. Just a stretch, nothing else.
And hold for how long?
Hold it for 30 seconds.
Morning and night?
Mornings and night, both sides, and do it about 4 times a day.
OK. And of course, you also use impact-absorbing insoles in shoes, and sometimes they need to be injected, etc.
And a little trick is to freeze a water bottle, just a mineral water bottle or something, and you can just roll it under the sole of the foot. And that allows you to numb the area and stretch it at the same time.
Noddy's Guide to Plantar Fasciitis. Elaine, who else have we got on the line?
I've got Marie from Guildford.
Marie, very quickly, how can we help you?
Well, I've had a very bad swollen foot, a painful ankle bone.
Right.
For over 2 months.
Right. Did you injure it?
I've had x-rays, and several doctors have said it's an infection in my ankle.
Right.
I've had an x-ray which confirmed that, and I've been given several lots of antibiotics, but my foot is still very, very painful and swollen. Now, I have bunions, but I have never, ever had any problems. I've walked.
I'll tell you what, Marie, I'm going to have to stop you there, because I think that with a complicated story like that, we're not going to be able to give you a sensible answer over the air. I'll give you a ring back a little bit later. You hold on to the line, make sure we've got your home number, and I'll give you...
Yeah, I think that's
a sensible thing to do. Otherwise, you're just going to be guessing. That's not going to be helpful to you. Sam, could you just sum up with your top tips for looking after your feet?
Yeah, so top tips are stretch your legs, get some wide, comfortable shoes, take your socks off sometimes to air your feet, and keep your feet dry after showering.
Mr. Sam Singh, thank you very much. After the break, Beating the Blues. Give us a call on 08712 442544 if you suffer from depression, or if you're worried about a friend or family member who doesn't seem to be themselves.
I'll be telling you how to recognise a sign of depression.